I will tell you, I am doing this partly because impeachment is so big that it tends to suck all the oxygen out of the room for all other news stories. But I also want to do this story I'm about to do tonight because just on its face, this is a thing that happened today that is likely to get squeezed out of the news because of everything that's going on in Washington and all these other things that are happening around the globe today. But this thing that happened today is absolutely flabbergasting on its own terms. And regardless of what else is going on, you should just know about this. So, yes, we are going to talk about what's going on with impeachment tonight in detail. Before we get there, though, I just want you to know about this other totally unrelated thing that is unfolding right now in the great state of Missouri. This week, you might have seen this headline floating around. Kansas City Star headlines don't always go national. But no matter what paper it's from, no matter what part of the country it's from, a headline like this is going to go national and get some national attention. As you can see, the headline there is, quote, Missouri health director kept spreadsheet of Planned Parenthood patients' periods. Let me read that one more time. The Missouri state health director kept a spreadsheet of women's periods? And if you're thinking that can't be right, there must be some misunderstanding. Maybe this is like a punctuation issue. He's the health director, so maybe this is something about colons, and it got typoed as semicolons, and then somebody made it into periods. It's nothing that... This is for real. In the Republican-led Missouri state government, the health director there has been tracking women's periods on a computer spreadsheet as part of his government job, which means taxpayers have been paying him to do that. Reporter Crystal Thomas from the Kansas City Star was able to get that story this week because she was in the courtroom for an ongoing hearing. It's sort of like a court proceeding. It's an administrative hearing. It's been going on all week. It's a hearing about the efforts of that state health director, who you see here, and the state government for which he works, their efforts to try to shut down the last remaining abortion provider in the entire state of Missouri. The Republican-led state government in Missouri is trying to make that state the first state in America to go completely dark in terms of access to abortion. And they're doing it by trying to shut down the last clinic in the state that does abortions, which is a Planned Parenthood clinic. Abortion, of course, is legal in this country. Access to it is a constitutionally protected right in this country. But Missouri's Republican state government wants to try to find a way around that inconvenient fact. They want to try to find a way to effectively ban abortion in that state by putting every abortion provider that remains in the state out of business using state regulations. They want to use state regulations under the direction of the state health director to regulate the last clinic in the state in such a way that it loses its license and is forced to close. That's how they're trying to eliminate access to abortion for women in Missouri. And that's what these hearings have been about all week. And in the course of these hearings, the state health director confirmed that, yeah, he actually has been tracking women's menstrual periods on a spreadsheet.
Let me just ask the next question. And you'll see here that it includes the patient ID number, date of procedure, gestational age, right?
Yes, sir.
And in the last column there, it includes the department's calculation of the woman's last normal period, right?
Yes, sir.
Yes, sir. It's the state health director in Missouri who is trying to yank the license from the last abortion provider in the entire state. And a state administrative board is trying to adjudicate that issue right now. In the course of those proceedings, he has admitted that he has been rooting around in patients' private medical records and making like a star chart of their periods.
And in the last column there, it includes the department's calculation of the woman's last normal period, right?
Yes, sir.
Yes, sir. That is how we are regulating the provision of abortion services here in Missouri. So Randall Williams gave that testimony earlier this week, a couple days ago. After the Kansas City Star wrote about it, it got a ton of national attention. It also led to calls that the Missouri State Health Director, Randall Williams, should resign. It led to the Democratic leader in the Missouri legislature demanding that the governor should immediately investigate this matter as to what this state health director has been up to. So Randall Williams gave that testimony on Tuesday that the state health department, under his leadership, created a period tracker as part of their efforts to yank the license to operate from the last abortion clinic in the state. Then late last night, more than 24 hours after Randall Williams admitted the existence of that spreadsheet under oath, more than 24 hours after reporters started calling his office from all over the country to ask questions about it, the Missouri state government finally put out this statement about it, again, late last night. It says, quote, "Irresponsible reporting has led to false claims that Dr. Randall Williams tracks the menstrual cycles of women seeking abortions at Planned Parenthood. Nothing in the Administrative Hearing Commission testimony that Dr. Williams gave on October 29th could in any way be cited to support this false claim." The state government of Missouri says nothing could be cited to support this false claim. State Health Director Randall Williams doesn't track the menstrual cycles of women seeking abortions at Planned Parenthood. No way. Right, Dr. Williams?
The last column there, it includes the department's calculation of the woman's last normal period, right?
Yes, sir.
Yes, sir. So this is just a remarkable thing. But there's one other piece of this that I really want you to see. We have been following this story in Missouri for months as Missouri Republicans, the state government there, tries to eliminate all access to abortion in that big state. And you may recall from that earlier coverage that it was this same state health director, Randall Williams, the guy in the bow tie here, who, in going after this same last clinic in the state earlier this year, he's the one who decided to order that any woman who wanted to get an abortion in the state of Missouri would henceforth be forced, on his orders, to undergo an extra medically unnecessary internal pelvic examination. Doctors already give patients a pelvic exam before a surgical abortion. That is a medically necessary thing. But starting earlier this year, Randall Williams and the state health department told the last clinic in Missouri, new orders, you now have to start doing this other pelvic exam in addition, an extra one, an extra internal vaginal examination, mandatory, at least 3 days before the woman actually gets her abortion. So we covered that earlier this year. It's just astonishing. And there was a bunch of national attention to the issue. The clinic ultimately defied those orders from the state health department. And after that, Randall Williams and the state government caved, and they stopped forcing them to do that. But today, this is just jaw-dropping to me. Today, at the same hearing that's been happening this week, where the state health director has now admitted that he's got a computer spreadsheet tracking women's menstrual periods. Today, there was testimony from Kawana Shannon, who's been a guest on this show. She's the director of surgical services at that Planned Parenthood. She testified today in this state hearing about what it was like when Randall Williams sent his inspectors to the last abortion provider in Missouri this year as the state was trying to yank that clinic's license. And she shared some new, important, and startling details about the conversations she had with those state investigators, the ones who were instituting this new medically unnecessary pelvic exam requirement.
You mentioned that during chart review of Karen, she had brought up why Planned Parenthood doesn't do a second pelvic exam. Did you explain to her why during that conversation?
I did explain to her why we didn't do a second pelvic exam. I explained to her that it wasn't medically necessary, but I got Dr. Eisenberg involved so he can explain medically why it was unnecessary.
How did she respond when you explained to her why?
So she said that she understood that we haven't been doing it this way. And she also understood that it may not have been medically necessary, but they feel that we should be doing it. We went back and forth with it so much that she actually said, look, Kawana, I'm sorry that it feels like we're much harder on you all in inspections than we are everyone else. But we have bosses too, and there's things that they want us to do.
We have bosses too, and there are things that they want us to do. So Kawana Shannon went on to talk about what it was like at Planned Parenthood after the state of Missouri went ahead with this policy, started mandating that doctors had to do internal vaginal examinations of their patients for no medical reason other than the state was ordering them to do it. Just watch this.
What about the two pelvic exam issues that you've raised? Did Planned Parenthood agree to do those?
So we did for a second. We wrote that in our plan of corrections that we would start doing day one pelvic exams on surgical patients.
Did Planned Parenthood at some point decide not to do that anymore?
We did.
And why is that?
Because it was the worst and most horrible experience ever. So patients were made to get undressed. Be violated for something that they already have to do. I don't know who cried the most that day. If Dr. Eisenberg did, if my staff did, if I did. We explained to the patients that this was not our doing and that we were only doing what we were told. You have patients that have been abused, raped, and you are putting them through an invasive, unnecessary pelvic exam for something that they already have to do on procedure day. And you have patients apologizing to us saying, I'm sorry you have to do that to me. I had to sit in a room with Dr. Eisenberg after that so he can emotionally get himself together. To the point where he was saying, Kawana, I don't think I can do this. I cannot go on violating women and sticking my fingers in unnecessary instruments in women every single day just because they want me to. And we decided that whatever consequences we were going to have, because to look at those patients in the eye for the days that we had to do that, it was unbearable. And not only is it my job to make sure that that floor runs operationally, it is also my job to make sure that I have staff who can mentally and emotionally be able to do their job. And no one was able to do their job that day or any other day that we made women take their clothes off, unnecessary to be invaded. And so, yes, that was horrible. So we decided we weren't going to do it anymore.
Is the State Department of Health still requiring that patients receive 2 pelvic exams?
So they changed the requirement to say that it is still in the regs that it is required. But now the physician can decide whether they want to do it on day 1 or day 2, and then they have to document it.
Do you need to take a break?
No, I'm fine, thank you.
Take a short break.
Yes, let's take a 5-minute break.
She said she was fine, but honestly, the room needed a break after that. She left the witness chair to utter silence in that room. Before the state took back that new extra medically unnecessary pelvic exam policy, more than 100 women in Missouri got a vaginal probe they did not need on orders of the state government. More than 100 women later, Dr. Randall Williams, the state health officer in Missouri, decided, well, okay, he'd roll that policy back. Now we know that since then, he's been running a spreadsheet monitoring individual women's periods. This hearing in St. Louis over whether or not abortion will stay legal in Missouri, that hearing was scheduled to go through the end of this week, but that changed. After Kawana Shannon's testimony today, which you just saw, the state did have the opportunity to bring the state health director, Randall Williams, back up to testify some more, to deliver more testimony about all the good work he's been doing in Missouri. After Kawana Shannon's testimony today, the state decided, A, they needed a break, and B, that they would not put him back on the stand. So these proceedings are now over. And now we, the country, wait for an answer about whether or not the state of Missouri will renew Planned Parenthood's license to operate, or whether that state government will succeed in making Missouri the first state in the country since Roe that doesn't have a single legal abortion provider anywhere in the state. Just remarkable. All right, we'll be right back.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.